Hi there, my name's Julie. I'm going to be your nurse today. I just wanted to do a quick pain assessment with you before we do an epidural dressing change. Can I just see your care bracelet here? Thank you. And can you tell me your first and last name?
David.
Perfect. And your birthday?
1995 before 15.
Awesome. And can you spell your last name for me?
D-O-T-R-O.
Thank you so much, David. Awesome. So first, can I just ask, are you experiencing any pain?
Yes.
Okay, where is this pain?
In the shoulder blade.
Oh, okay. And when did that pain start?
2 days ago.
Yeah, and what started it?
I crashed on my bike.
Yeah? Okay. And does that pain stay just in your shoulder blade, or does it move to other places?
Stays in the muscle.
Okay, and can you describe the pain? Can you use like a descriptive word? Is it like a dull pain or a sharp pain?
It's like a muscle pull.
It feels like you pulled the muscle?
Yeah.
Yeah, and that was how many days ago?
2.
2 days ago, okay. And if you were going to rate your pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you can ever imagine, what would you rate it as?
5.
A 5? Okay. And is that an acceptable level for you, or?
Yeah, it's fine.
It's okay. Did you want me to get you some Tylenol or anything for that?
Massage would be nice.
Okay, yeah, I can do a massage for you. Perfect. Okay, we'll do that after the dressing change.
Okay.
And hopefully that should help your pain.
Yes.
Okay, so do you have any other concerns of pain for me?
Nope.
Okay. And are you comfortable right now for the dressing change?
Yep.
Perfect. And do you need to go to the washroom or anything?
Nope.
Okay. Sounds good. We'll just get started then. So what I'm going to be doing is you have an epidural in your back here. And what I'm going to be doing is just taking off the dressing that's there, giving it a nice clean, and then I'm going to be putting a new dressing on. And the reason that we're doing this is because it's been on, you've had the epidural for about 5 days now, so it's a policy to change that epidural dressing every 5 to 7 days.
Okay.
Okay? Perfect. So if you have any questions, just let me know. First thing I'm going to be doing is I'm going to be removing the existing dressing. But before I do that, I'm just going to be checking the actual epidural insertion site, just looking for signs of infection. So I'm looking for redness, swelling, or I can do heat as well. Probably won't touch that before I put on my gloves, but I'm not seeing any redness or swelling or anything like that, so I don't anticipate there being any heat, and therefore I don't suspect any infection there. So what I'm going to be doing first is putting on some clean gloves. Of course, I washed my hands right before I saw my patient, and I would have just washed my hands before putting on my clean gloves. Just don't have my sanitizer bottle near me for this video. So I'm putting on clean gloves to remove the dressing. And as you can see, my epidural, for the sake of this video, is headphones. And this MeFix would be running up the back of my patient to keep it secure, but I just don't have enough MeFix, so it's going to only just be this long. So first thing I'm going to be doing is taking the MeFix off, and I know that I'm not going to be pulling this way off because I don't want to dislodge the epidural from the site. So I'm going to be pulling this way, and I would have another nurse with me with sterile gloves on to be holding the epidural steady while I do this. But I don't have another person, so I'm just going to be doing it myself and doing my best not to dislodge the epidural. So David, this might hurt you a little bit because you have hair on your back. So just take some deep breaths while I do this. And let me know how you're doing. Is everything okay?
Oh yeah, it's fine.
Okay, perfect. So, because I'm touching the epidural cord, I probably should be having sterile gloves on, so I'm not going to touch it. I'm just going to be very gentle here, and I'm not seeing it moving at all down there because I haven't taken that dressing off yet. And that looks really good. So I'm going to just put that in my garbage. So next thing I'm going to do is going to be removing this dressing. So again, I'm going to be very gentle, and I'm going to start from this side and work my way down towards the insertion site. And it might move because I haven't taped the actual insertion site down, but I will be careful. How does that feel, David?
Feels good.
Okay. So I'm just being really gentle here as to not move the epidural insertion site. Perfect. And I'm not touching the epidural or the site with my clean gloves on. I'm going to be putting on sterile gloves. Okay. Okay, so it's all exposed now. I'm gonna take off my clean gloves. I'm going to wash my hands. Okay, so now what I'm gonna be doing is I'm gonna get my dressing tray, sterile dressing tray ready. So I'm going to, I'm not using sterile technique, only touching the outer inch border. And I would have more of a surface if I were actually doing this in the hospital. Okay. Oh, and that would not have touched my epidural. Okay, so I've got my sterile dressing tray. Move things out of the way. Not touching anything with my hands. This I can put on the outer border, like so. Okay, next I'm going to be adding in some of my equipment into my sterile field. So I've got the MeFix, which I would be taking out of the package new and dropping it in because it's sterile. And I'm going to drop in my new dressing. Perfect. Make sure that's in my sterile field. And I've got these guys. If I need to touch anything in the sterile field, I can use my prongs there. Okay, so I'm going to put this in my sterile field. Maybe I can do it like that because the inside is still sterile. And I'm gonna use 2 for this video so that I can save this one, but in real life I'd be using 3. So last thing I'm gonna do, and maybe I'll do it over here, is put my sterile gloves on. So open the package. My patient's getting antsy. I'm just putting my sterile gloves on, patient, and then I'll be with you shortly. No, I haven't seen it. Okay, so that glove's on. And the reason I'm using sterile gloves is because this epidural is located in my patient's spinal cord, and I don't want to introduce microorganisms into my patient's spinal cord. So I'm reducing the risk of infection. Okay, now I've got my sterile gloves on. I can touch things inside my sterile field. First thing I'm going to be doing is, I don't see any like discharge or anything there, so I don't need to be cleaning that up with my sterile gauze, but if I had been seeing any sort of discharge there, that's what I would be using. Maybe like wiping it with here, just kind of around. But like I said, I don't see any there. So what I'm going to be doing is I'm going to be taking my chlorhexidine swabs, and I want to make sure that there's no alcohol here in these. It's not a swab that has chlorhexidine and alcohol, it's just chlorhexidine, because if I had alcohol in it, it can cause toxicity if that enters my patient's epidural site. So what I'm going to be doing is using one side of the pad, and I'm going to be going beside it this way, up and down. And my patient's moving, but the epidural cord would not have been moving. Now I'm going to use the other side. Go the other side here to clean the area. Perfect. Now that's garbage, and I have my garbage over here. Okay, next I'm going to be going down here with one side of my swab. And now on the other side, clean side, I'm going to be going on top. Okay, so now I would be getting a third clean swab, but I don't want to open it to use up my supplies, so let's just pretend this is a clean one. And I'm going to be going up this cord and getting a new side and cleaning up the cord. Perfect, so now my site is clean and it looks quite wet, so I'm just gonna let it dry for a minute. And what I will be putting on, it's in my sterile field, is my dressing with a clear window so that I can keep an eye on how the epidural is looking. I'm pretty sure I have to wait until it's totally dry, until I put this dressing on, because I'm not sure it will stick otherwise. So I'll just wait, I guess. And so I'm going to be sticking this on and using the sticker here to label when this dressing change was done and by whom. And then I'm going to be putting this Me-Fix on up the back, up to the shoulder ideally, just so that the epidural does not get dislodged. And let's just say that that's dry. So I'm going to be peeling off this and placing it, my epidural, and really gently sticking it on there as to not dislodge the epidural. And now I can take off the outside. Good. Okay, and I will label this. Maybe I have to do that after because I have my sterile gloves on right now. So now I'm going to do my Me-Fix. And these I find tricky to open. But I'm still wearing my sterile gloves because I'm still going to be touching the epidural cord. Okay, that's garbage. Put this one now. Just from the base of that dressing, and ideally straight all the way up the back, trying to be very gentle as to not disturb the insertion site. Here we go. And I no longer need my sterile gloves, so I will take those off. My garbage, and then, like I said, labeling the sticker and placing it maybe there. And that's my epidural dressing change.